How does VA healthcare work? Not very well, according to a lot of veterans, but it is a reliable way to get help with your healthcare and medications if you figure out how to navigate the bureaucracy. I've spent over 15 years studying and dealing with the VA, so let's break down what it takes to get and use your health benefits from the Department of Veterans Affairs. First, you need to establish your eligibility. You may be eligible for VA healthcare if you served on active duty in any military branch and did not receive a dishonorable discharge. However, there may be additional requirements depending on when and where you served. There are a lot of loopholes in everything the VA does. For example, there are special rules for veterans who enlisted after September 7th, 1981, or entered active duty after October 16th, 1981, as long as they served 24 continuous months or the full period for which they were called to active duty. But that rule does not apply to you if you were discharged due to a disability, a hardship, or an early out, or if you served prior to September 7th, 1981. It's a bit of a mess. So there's a full list of eligibility guidelines on va.gov, and I'm not going to walk you through in and every loophole in this video because we'll be here all day. And I know what you really want is to figure out how the system works. So after you determine your eligibility, the next thing you need to do is apply. Applying for VA healthcare is actually a lot easier and faster than applying for VA disability benefits. You can apply online using the official VA website or by calling 877-222-VETS, which is 8387 if you'd rather not worry about those letters, or by applying in person at your closest VA medical center. It takes about 30 minutes to apply, and you will need your social security number, military discharge information, insurance card, and income information. It only takes about a week to get your decision on your health care. Now, once you get that decision, you will be assigned a priority group if you are approved. You'll get a welcome call and a printed copy of the Veterans Health Benefits Handbook, and at this point, you'll be notified what your priority group is. And this is where it starts to get complicated. See, not everyone who receives VA healthcare will get the same care. The VA divides eligible veterans into 8 different priority groups, and Priority Group 8 actually has 6 different subgroups, so there's actually 14 different priority groups that veterans are sorted into. It's a bit of a circus. The priority groups basically work like this. Priority Group 1 is for veterans who have received a Medal of Honor or who receive individual unemployability or have a service-connected disability rated at 50% or more. Priority Group 2 is for veterans who have a service-connected disability rating of 30 to 40%. Priority Group 3 is for veterans who have been a former prisoner of war, who received a Purple Heart Medal, those who have a service-connected disability rating of 10 to 20%, those who were discharged due to a disability that was caused by or worsened during service, and those who were awarded special classification under Title 38 USC 1151. Now, if you are eligible for more than one of these priority groups, the VA will automatically assign you to the highest one you are eligible for. Priority Group 4 is for veterans who receive aid and attendance benefits or have been determined to be catastrophically disabled. Priority Group 5 is for veterans who are receiving VA pension benefits or Medicaid. Low-income veterans who do not have a service-connected disability or at least don't have one rated higher than 0% are also placed in this group. Priority Group 6 is for veterans who have a service-connected disability rated at 0% or meet certain specific service criteria. For example, veterans who served on active duty at Camp Lejeune for at least 30 days between August 1st, 1953 and December 31st, 1987 are eligible for this group. Certain World War II, Vietnam, and Persian Gulf War veterans are also eligible, as are newly returning combat vets. Priority Group 7 is for veterans who have low income and agree to pay copays. Priority Group 8 is for veterans who agree to copays and aren't eligible for a higher priority group. Now, within Priority Group 8, there are still 6 separate sub-priority groups with different eligibility criteria. I'm not going to go into all those right here. You will be assigned to the highest group that you qualify for, and the VA enrolls higher priority veterans first to make sure they are serving the people they deem most in need. The goal is to make sure that they are balancing the demand at the VA healthcare centers. Haha, but it definitely sucks for the people who are placed in lower priority groups. Once you've got your priority group assignment, you will be enrolled in VA healthcare. During this process, you'll be assigned a patient-aligned care team, or PACT. which will provide your primary care services. The team will include a primary care provider, assistant, licensed practical nurse, registered nurse care manager, and a clinical pharmacist. This team will be responsible for managing most of your care, including your medication refills and your referrals to outside providers. In order to see a specialist or outside provider, you will have to consult with your primary care team and get that referral in advance. Your VA healthcare benefits will cover your primary care and specialty care visits. They have a wide range of specialty providers at the VA, including cardiologists, gynecologists, mental health providers. They even have home health, prosthetics, and pharmacy departments. The vision department can provide routine eye exams as well, and some veterans are even eligible for dental services. In the event that you need a specialist that is not involved in the VA healthcare system, you may be able to receive help from an outside provider through their community care system. However, that does require you to set that up with your primary care team from the VA in advance. At this time, the VA does not cover cosmetic surgery, gender-affirming surgeries, health club or spa memberships, or medications that are not approved by the FDA. However, for medications that are FDA approved, you can have them filled by the VA even if they are not prescribed by a VA provider, as long as the medication is something that the VA pharmacy provides and your VA primary care provider agrees with the prescription. This can help you save a lot of money on medications, even if you don't use the VA for primary care. Your medications will typically be delivered through the mail unless you want to pick them up in person at the VA Medical Center. Now, if you live too far from a VA Medical Center or the VA can't provide the services that you need in a reasonable amount of time, you may be able to receive care from a community provider through the Community Care Program. However, once again, you do have to work with your VA provider to coordinate that in advance, or the VA will not pay for it. The VA can also pay for non-VA emergency room visits if you feel like your life or health was in danger at the time and you cannot reasonably make it to the VA emergency room. If you do visit a non-VA ER, you will need to notify the VA within 72 hours. Now, as someone who has dealt with this system before, I need to tell you, you need to notify the VA of a non-VA ER visit, even if you think the hospital has provided that notice. When my husband went into the ER in November of 2019, I was standing at the desk when the nurse from the hospital called and notified the VA, so I didn't call in. And in the end, it was a fight to get the VA to cover that visit because they claimed I failed to notify them, even though I was present when the nurse called them and coordinated and got permission and all of that stuff. So even if you think someone else has notified the VA, notify them yourself anyway so that you don't have any issues. Another cool feature of VA healthcare is that they will reimburse you for your travel costs. If you have a 30% or higher VA disability rating, or you are traveling because your appointment has to do with a service-connected disability, or you receive a VA pension, or you are low income, or you are traveling to a comp and pension exam, then the VA will reimburse you for your travel to and from the VA facility or even a community care provider. Now, what do you do if your VA care isn't working as it should? Because we get that complaint a lot. You can always reach out to the patient advocate at your local VA Medical Center. You can also talk to your provider's supervisor or the chief of service at your local VA. These people can help you if you disagree with your provider, or if you have a personality conflict, or you feel like you aren't getting the help that you need. I hope this helps. Don't forget to check out our other videos for more ways that you can save money and get free stuff.